Did you just sprain your ankle? We're going to go to the top 5 rehab mistakes people are making when rehabbing their ankle, which is limiting their ability to get back to the court pain-free. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So let's jump into the topic of lateral ankle sprains. All right, guys, so we're going to talk about ankle sprains and the rehab mistakes associated with it, because a lot of the times an ankle sprain could be the worst nightmare for a basketball player because it sometimes gets left untreated and leads to issues down the line. And we'll discuss more in this video. But a lateral ankle sprain, just to kind of give you guys the anatomy, it usually happens when you land on someone's foot or you land and your foot goes out to the side. It's different from a high ankle sprain and also from a medial ankle sprain. The lateral ankle sprain is the most common with basketball players. But let's just jump into it. If you guys want to learn more about ankle sprains, click the description below. We have a great video talking about it, but let's jump into the top 5 rehab mistakes. All right, guys, so rehab mistake number 1, stop resting and icing. That's not going to be your answer. Resting and icing does help a little bit, but that's not going to be the solution. And that's not going to be the only thing that you got to be doing for your rehab. And a lot of the times, honestly, every time I talk to a basketball athlete, it's like, hey, how's your ankle sprain? Oh, I just rested and iced it a couple days and I think I'm good. And they're hobbling, they're not even 100%. And the reason why is that resting and icing will not do anything to the impairments that are associated with an ankle sprain. Those impairments are lack of mobility, lack of strength, and lack of stability. All these impairments happen because you're resting and you're not loading that ankle and the ankle gets stiff. But resting in ice does play a role in the rehab. So initially, you do modify rest. You're not running out there, you're not playing basketball, but you are doing your rehab. And icing, a lot of people say don't ice it, it affects the inflammatory process, but I like icing. The reason why is that it helps decrease pain. When it helps decrease pain, it's gonna allow us to do movements. So I'm not against resting and icing. I just, like we mentioned, it's not the solution in ankle sprain rehab. It plays a role. You go modified rest and you do ice it, but that's not gonna be the only thing you gotta be doing with your rehab. Rehab mistake number 2, guys. A lot of people don't even do rehab or wait too long to do rehab. So those are 2 big problems. 1, if you wait too long, it's gonna push your timeline to go back to sport even longer. The other one is people don't even do rehab. They go back to their rehab mistake number 1. They're like, I just rested and iced. And that's not the solution, guys. Like I mentioned, whenever you sprain your ankle's gonna get stiff. Also, sometimes your ankle will be unstable. It's too loose. You don't have proprioception stability. And also will get weaker. And that leads to compensations. That leads to increased injuries to the knee or reoccurring ankle sprains. So you gotta be on top of your rehab. We have a great rehab program. We have the description below in our link, but it's a great way to really accelerate the rehab process. You gotta start early and start often. There's a lot of things that you can do early on. One of the main things early on in rehab, after you sprain your ankle, is decreasing that swelling, working on your range of motion, and maintaining some of your strength and normalizing your gait pattern. So there's a lot of things you can do early on when it's a severe ankle sprain, even like when you could barely walk. There's a lot of things that you can be working on, but you got to be working on your rehab. You can't wait until the pain goes away to start rehab. That's already too late. You got to jump on it now to work on that mobility, stability. So that's rehab mistake number 2. Rehab mistake number 3, and this is kind of a controversial one because I understand it from point of view, but not putting weight on your foot. So if you sprain your ankle, you see a lot of people on crutches or they're limping for 2 weeks. They don't want to put any weight on it. They're using the crutches. But guys, if you get an x-ray and you rule out a fracture, you can start putting weight on your ankle right away. And if you can't put weight on your ankle after you sprained your ankle, the first question is you got to go to the hospital and make sure you get an x-ray to rule out a fracture, because you never know. Because one of the signs for a fracture is if you can't put any weight for a couple steps there and it hurts in the outside portion of the ankle. And we have a great video talking about the rules, the Ottawa rules, when it comes to ankle sprain and ruling out a fracture. But if you rule out a fracture, you got your x-ray and you're still not putting weight on it, you got to start loading that ankle. Use the crutches and start using a step through gait pattern where you're putting weight on your foot, but you're using the crutches to offload it a little bit. We don't want complete offloading of the ankle because then the ankle gets stiff and then it gets weak. So as long as you don't have a fracture and you're using crutches to normalize your gait pattern, you're okay to put weight on it. And we see this all the time. All right, guys, rehab mistake number 4. So now we're going into the rehab portion of it. So you did your rehab, but you haven't done your rehab all the way, because number 4 is not getting that range of motion of your ankle, specifically the dorsiflexion motion, meaning the ability for your ankle to bend forward, the same as the opposite leg. And the reason why we need to focus on this is because if you don't have the same motion or very similar motion to your opposite leg, it just increases your risk for injuries at the ankle. Studies have shown that it increases the risk for recurrent ankle sprains and also increases more stress in the knee joint, because now the ankle can't bend as much, so the knee has to do more of the stress there. One simple test that we like to use with our athletes is the needle wall test, where you use the wall as your guide and you try to touch the wall with your knee, keeping your foot down on the ground as much as you can, and you try to go as far back as you can, and you measure the distance between the wall and your toes. The further your foot goes, the better the mobility. The closer it is to the wall, that means you don't have as much mobility. You compare those side by side, and you want to be as close to that 80-90% as much as you can. We've seen so many people saying like, hey, my knee hurts, and we check their ankle, and when we see their mobility very limited, and we're like, hey, have you noticed why your ankle's not as mobile? And they're like, oh yeah, I had an ankle sprain and I wasn't able to really move my ankle. And that's what causes these issues. So really focus on getting that mobility back as soon as possible, because we don't want the ankle to stiffen up a lot and then you're really limited, and then it really affects you down the line. So early and often, make sure you get that range of motion back as fast as you can. All right, guys, the last rehab mistake, and this one I don't really blame the athletes because there's not that many resources, and that's why we created a lot of the resources for you guys. But the big thing is not doing the return to sport testing or not doing return to sport rehab. So a lot of the times people are like, you know what, my ankle, I don't have any pain, there's no swelling, I think I'm good, let's go back to playing ball. But the reality is, if you want to decrease your risk for future ankle sprains, and as we know that once you sprain your ankle once, you're like at 60% increased risk to re-sprain it again. So in order to decrease that, we don't want those reoccurring ankle sprains, we got to make sure we do return to sport testing. And some of the testing include doing a calf raise test, a heel raise test, meaning like how many heel raises or calf raises can you do on one leg versus the other. Another one is, like we talked about, the rehab mistake number 4 is mobility. Do you have the same mobility on one leg versus the other? Another aspect to it is a hop test. We do a lot of hop tests, and all these tests are in our ankle sprain return to sport program. The link for that program is in the description below, but this is a great way to test yourself, see where you're at, and be honest. If you're like, you do the testing, you're at 80%, you're like, oh, I need to do a little bit better so I could get to that 85-90% of my other leg. Because a lot of the times we're like, yeah, I think I'm good, I'm hopping, but if you compare it to your other side and you're nowhere near close to that, then we put ourselves at risk for reoccurring sprains, more injuries, more time off. So make sure when you do that ankle sprain, you're ready to go back. You don't want to push through it and then go back too early and then cause those recurring injuries and not be able to play basketball for a longer amount of time. All right, guys, let's summarize the top 5 rehab mistakes. So number 1, the big thing with a lot of the times, people just rest in ice. So like I mentioned, rest in ice plays a part of the equation, but it's nowhere near the final product, and we need to be doing our rehab, not just resting and icing. Number 2, a lot of people wait too long to do rehab until their ankles there's less pain, there's less swelling, or other people just don't do rehab at all. But you got to start early and often, work on that range of motion, that swelling, normalize that gait pattern. You got to start early. Rehab mistake number 3, people don't put any weight on their ankle after they sprain it. If you rule out a fracture, like because you had an x-ray, because you couldn't put weight on it or it hurt too much to put weight on it, then you should be good. As long as there's no fracture, you can put weight on it, use the crutches to assist you to help facilitate that, but you got to start putting weight on it. Rehab mistake number 4 is not getting that mobility back to the opposite leg. So a lot of times people are like, oh, my ankle's good, but when we check their mobility, it's completely off. One side is way less than the other side. What happens then is it's going to affect our ability to, 1, be able to do movements. On one side, you'll be able to bend your knee a lot more, and the other one you wouldn't when loaded. The other thing is it increases your risk for reoccurring ankle sprains and injures the knee. Number 5 is the return to sport testing. You got to make sure you're ready to go back to sport, or else you'll keep spraining your ankle and keep having issues in the ankle, foot, knee. So that's why we created our online rehab programs, not only for you to do rehab from A to Z all the way back to sport, but for those people that their ankle feels good, they don't need to do the basic stuff or the fundamentals, they want to test themselves, we have a great return to sport program as well, where it has return to sport testing and it tells you where to start off if you don't pass these tests in a certain situation. So to conclude all this, guys, make sure the big take-home message is you do your rehab. An ankle sprain could be your worst nightmare if you don't rehab it properly. And that's a lot of times. It might lead to that ACL tear, it might lead to that patellofemoral, jumper's knee, or reoccurring ankle sprain. So make sure you do your rehab, and we have the resources here. So comment below if you guys have any questions regarding these rehab mistakes, or if you're dealing with an ankle sprain and need help, send us an email. We work in Southern California, but we also work with clients online. And we are the basketball doctors. Let's ball for life.